Thank you for watching my presentation on comparative healthcare, comparing two countries, Kenya and Ireland. So first to talk about Kenya. Kenya is the seventh largest country in Africa, has a population of about 55 million people, two official languages, and over 40 ethnic groups make up Kenyans. According to the World Bank, Kenya is a lower middle income country. My second country is Ireland. Ireland is a member of the 27-nation European Union, has a population of 5 million people, which is approximately the same population as the state of South Carolina, and is classified by the World Bank as a high-income country. And one interesting thing about these two countries is while they're very different, they both have a shared history of colonization from the British. So let's talk about age, population-wise first. Let's start with Kenya. So Kenya is a relatively young country. The average age of a Kenyan is 20.9 years, which is in contrast to the global mean of about 30. And that makes Kenya the 34th youngest country in the world. And you can look at the age distribution on the left. You see the distribution in 2023. And the largest cohorts are the 0 to 4 and the 10 to 14 cohorts. Projections moving forward through 2050 project that the 10 to 14 age group will continue to be one of the largest cohorts, in addition to 15 to 19. And so, as you might expect, the leading causes of death in Kenya are not diseases of aging. You can see that for females, the leading causes of death are lower respiratory infections, HIV/AIDS, and stroke. And for males, the largest causes of death by far is tuberculosis, followed by road injury. As opposed to Ireland, which has an older and aging society, and what we see in Ireland is something that would be recognizable to folks who understand the United States. Ireland is the 61st oldest country in the world, has an average age of 39.8. Again, the global mean is 30. And you can see that, again, according to the age distributions, the largest cohort in 2023 is 40 to 44. And then when you look at the projection forward to 2050, for females, it is 65 to 69. And for males, it's still 40 to 44. And of course, what's most striking here is the real change in shape of that age distribution between 2023 and 2050. And you can see how the top end of that distribution really widens is expected to widen over the next 27 years. And again, not surprisingly, based on that, the leading causes of death in Ireland are all pretty much diseases of aging. So you could see heart disease for both men and women, Alzheimer's disease, other dementia, lung cancer for males, so lifestyle disease. And so the two countries have very different average life expectancies. You can see the life expectancy at birth for Kenya is 66.8, while the life expectancy at birth for Ireland is 81.6. So let's talk a little bit about the healthcare systems. So in Kenya, most healthcare is paid on a pay-as-you-go system. Only about 30% of the population has health insurance. And those with insurance are more likely to be those who are either part of the formal economy, those with higher incomes, and those living in urban areas. Today, Kenya is looking to make a transition from what they call the National Health Insurance Fund to a universal scheme called the Social Health Insurance Fund. Ireland, in contrast, has a hybrid public-private system. And you can see that about 42% of the Irish population qualify for a full medical card. About 10% hold what they call a general practitioner card. And about half the population carries private health insurance. And interestingly enough, according to a UK consultancy, the Ireland system has been ranked 23rd best healthcare system in the world. In contrast, Kenya's has been ranked 114th, and as a point of comparison, the United States health system has been ranked 69th. There are very different sources of funding for how healthcare is paid for in Kenya and Ireland. In Kenya, as you can see, it's split evenly between households and government. But what's interesting there is that about 22% of healthcare is funded through private donors. Ireland, in contrast, 75% is funded by the government, with 12% each from households and corporations. So healthcare challenges. Let's start with Kenya. So I know we have a lot of discussion on this paper that everyone's written around long-term healthcare, but that's really not one of the top challenges faced by Kenya today. Now, that doesn't mean there's a good system of long-term care in place. Various reports have highlighted that there's too much reliance on family members. There is a lack of long-term care locations. There's ageism, and there's really the taboo about death in Kenya. But really, the most pressing healthcare challenges in Kenya are really around death caused by preventable means and access. And as opposed to Ireland, where these are challenges that we would recognize in the United States: long-term care of an aging population and a shortage of healthcare workers. And so when we talk about the United States and lessons that we can learn from these two countries, both Kenya and Ireland strive for the goal of universal coverage, which is not really something that the United States, for the most part, has really striven for over the course of the last 50 or 60 years. The importance of vaccinations and keeping controlled diseases controlled. Very much a hot topic today in the United States, and we can see some of the consequences of not being able to do that in terms of the life expectancy of Kenyans. And then, of course, looking at the percentage of funding coming from donors, the value in being a force for good in the world seems like a lesson that the United States really needs to understand and think through now. Thank you.